Dear learners, welcome back to NPTEL online certification course on novel drug delivery systems. I am Dr. Satish Devanapilli, Assistant Professor at Department of Pharmaceutical Sciences and Technology, Institute of Chemical Technology, Mumbai. In our novel drug delivery system course, we are discussing the intrauterine and implantable drug delivery systems. In our previous class, we have discussed these are the various points on what are the implantable drug delivery systems, and also we have seen the drugs which can be delivered by the implantable drug delivery system, and then we have seen the currently available marketed products of the implantable drug delivery system. Then we have discussed advantages and the disadvantages, and also we have seen the what are the ideal characteristics for an implantable drug delivery system. Then we have seen the various applications of the implantable drug delivery systems. So, today we are going to discuss on some new topics on the classification of implantable drug delivery systems, and also we will see the osmotic drug delivery systems. So, in continuation to previous topic, we will first discuss what are the types of the implantable drug delivery system, and in that we were going to see the osmotic drug delivery systems, and that is what are the osmotic drug delivery system, and then we will see the structure, what are the components available with the osmotic drug delivery system. If time permits, we will go to ideal characteristics, and we will see in another session advantages and limitation and the various types of the osmotic drug delivery systems. So, yes, in the implantable drug delivery system, it can be classified into the three categories based on the polymer degradability, and the second one is based on the release mechanism, third one based on the application or the target site. So, with this we can classify the implants into three categories. So, the first one is the polymer degradability, and in that we have again classification into two things, that is biodegradable systems, non-biodegradable systems. So, in the release we have a diffusion controlled systems and chemically controlled osmotic control systems, and applications based on the various diseases and the target site we can have the further applications. So, based on the polymer degradability, yes, it is not compulsory to select only biodegradable polymers. There are the cases we use implants inserts, so that not to be degraded. So, which are called as non-degradable, but that need to be removed from the body after the treatment, after the complete release of the drug from the implant, which are called as non-degradable. And yes, in case of biodegradable systems, we need to select only biodegradable polymers, for example, polylactic acid, polylactic co-glycolic acid, which is called as PLGA, and polycaprolactone. Also, we can use some other biodegradable polymers like polyanhydrates, so which can also be used for the biodegradable implants. So, which are made from the polymers which are naturally degrade in the body after the drug release, which are called as biodegradable implant systems. So, yes, no surgical removal is needed after the therapy is completed. That is a one great advantage which comes from the biodegradable system, but during the application we have to do the surgical process or small incision we need to done on the patients, then further it follows the drug release and the treatment. So, the drug is released as the polymer erodes or hydrolyzes. So, it will undergo naturally degradation through erodation or by the hydrolysis, your drug will release slowly. Yes, this can be suitable for short to medium term therapy. So, because of the degradation. So, if you select non-degradable, it will the time may extend to years also. Now, here is a one simple exam you can see as we discussed gliadel wafers which will you place in the brain for the treatment of the brain tumors, which you can see in the picture, that is carmustine implant which contain 7.7 mg of the carmustine per wafer. Now, you can see the use, that is intracranial use. So, that is the application, or you can say the target site for the treatment of brain tumors. Each sterile water contains 192.3 mg of polyprosan and carmustine, right. So, these need to be provided with the formulation, right. So, each pack contain the 8 wafers, these are all are sterile wafers. Now, you can read here very clearly, it is an intracranial use and which each sterile wafer contains the drug as well as the some of the materials ingredients which help for the solubility and the permeation. So, now you can see the placement of these wafers. So, during the treatment through intracranial route, so doctor will place these wafers into the in the brain. So, for the treatment of the brain tumors, that will release the carmustine for 21 days. Most of the drug released within the 5 to 7 days, and this course will after this within 6 to 8 weeks the wafer will completely undergo degradation. So, which is called as biodegradation mechanism. Now, coming to the second one is the non-degradable implants. So, we have to made an insert with the stable polymers that do not degrade in the body. So, these are the polymers like silicon elastomer, polyethylene vinyl acetate EVA, polyurethane and polyvinyl alcohol. So, these need to be removed after the treatment or complete release of the drug. This require surgical removal or replacement after the drug reservoir is exhausted, completely released. Now, you can see the two differences compared with the biodegradable, non-degradable. So, here we need to undergo the surgical process after the treatment. And second point is that these can go for longer days compared with the biodegradable, because of non-degradability we can sustain for the long term therapy. Now, here one example you can see the Norplant implants which comes in the market. These are the subdermal implants. In previous is intracranial use. Now, here is the subdermal implant. Now, you can see the doctor is placing the insert to the patients through subdermal route, and this can be used for the long term contraceptions which contains the levonorgestrel, and that will help for the 5 years to prevent the pregnancy. So, with placement of this, it will help for the treatment which we can work out instead of taking the weekly or monthly doses. So, once you place, this can work for the 5 years. This is a true example of the non-degradable implants. So, we can see that how it works and efficient for long term drug delivery. So, after the treatment, so we need to remove the implants. Now, you can see here the implants in the picture. Now, based on the release mechanism, so that is the first one is diffusion controlled system. Based on the release mechanism, it is first class is diffusion controlled systems. So, drug release occurs via diffusion through the polymer matrix or membrane. Now, we know that we have seen very detailed in the controlled drug delivery systems. these are works in the diffusion and dissolution control systems. There are the combinations also we have seen. Now, we know that two systems are there, one is the reservoir system, second one is the matrix system. Now, that we can see in the pictorial representation. So, this is the reservoir system. So, drug will be worked as in cargo, nothing but which will be placed in the core, and outside the shell you will see, you can see the separation of the drug and the carrier materials. Now, here also you can see the shell is covered with the drug carriers. So, drug carriers are encapsulated in the core systems and then further coating with the shell materials. So, which will help for the control release, whereas the matrix system. So, the drug is uniformly dispersed into the shell. There is you cannot separate, or there is no two systems in the matrix system. So, the drug is embedded in the shell, so which is called as matrix systems. So, drug is dispersed uniformly throughout the polymers. Now, here you can expect the zero order release or constant rate. The example is via Dur. So, this provide the implant of the leuprolide acetate implant, and here we can see the diffusion and also works by the polymer erosion. The NOR plant will help for the treatment of the hormonal replacement. And the second mechanism is chemically controlled systems. This also we have seen in case of stimuli response systems and also in the event control release also. So, drug release from the implant is governed by the chemical degradation process of the polymer or cleavage of the covalent bonds between drug and the polymer. Now, here we use the biodegradable systems which can be controlled by the hydrolysis and the enzymatic reactions. Now, this is the implant which is cross linked with the polymer and also with the drug, right. Now, you can see the networks which is, you can see in the example nanogel networks which are cross linked with the drug. So, which definitely contains the polymer, but these polymers are undergo stimuli response by the chemical reactions in the body, by the hydrolysis or by the enzymatic action. So, then the drug will slowly release as per the requirement, right. So, you will see the chemical control release after the interaction with the hydrolysis or by some enzymatical conditions, and then drug you will see the release, which are called as chemically controlled systems. And here third one is the osmotically controlled systems. So, here which works on the based on the principle of osmotic pressure. So, in our upcoming classes or in the upcoming slides, we are going to see what is the osmotic drug delivery systems, right. So, there we will understand what is the role of osmotic principle. Osmotic pressure is the principle will help to release the drug from the devices. Okay. So, yes, this device contains semi-permeable membrane that will separate or that will help for the transfer of the water from the outside to inside, and also we use some osmotic agents. So, preferably like mannitol and other type of ingredients we use as an osmotic agents will help for the osmosis, and yes, which can provide the zero order release for the osmotic drug delivery systems. The example is Duros implant system used for the delivery of the leuprolide in case of prostate cancer. Now, you can see the picture representation of the osmotic control systems. So, you can see the outside, it looks like a capsule, or sometimes it may also comes in the tablets as well. So, it looks like a capsule and the outer layer is semi permeable membrane. So, this will help in the entry of the water molecules from the outside, from the GIT to inside of the system. So, once it is entered, the osmotic layer will induce the pressure, that is osmotic pressure. So, that will help to push the drug molecule, that is the agents, nothing but drug molecules, and this entire system is implantable reservoir and this is a flow moderator. Once the pressure is developed, and that will release the drug from this orifice and drug will come out from the system. So, and yes, this is a based on the osmotic pressure and based on the concentration inside of the formulation, right. So, once it is equilibrium, then it will stop the release. So, which is called as osmotically controlled drug delivery systems. Now, the third class is based on the target or the application. We already discussed in our previous lecture in the introduction of the implant drug delivery systems. There we discussed the role of implants and also the various application we have discussed in cancer, also chronic diseases, and also we have seen some hormone replacement therapy. So, here also we can use like as we discussed in case of the gliadal wafers, that is intracranial implants, also occusets, intraocular implants. Also we have right now we have seen one more example on the contraceptive, and also we have intravaginal implants, that is Minera, we can also use for the treatment. So, these are the various polymers and these are the manufacturing techniques, like by using hot melt extrusion, also by the injection or molding method, by 3D printing or compressing into the various types of solid dosage forms will help for the treatment of the various diseases. So, if you want to know more on this, you can prefer this paper that will help for the further studies. So, here we are going to discuss on osmotic drug delivery systems. So, yes, before going to the new topic, we need to discuss on the what is osmosis and how this will helpful for the drug delivery systems. Now, we know the osmosis is the principle which will help in the osmotic drug delivery systems. So, these devices are inserts that use the principle of the osmosis to release the drug in a controlled way. How do they work? The pressure is applied to the higher solute concentration site to resist the solvent flow is called as osmotic pressure. Now, we will understand, first we will read the definition, then we will discuss on the how it works. So, osmosis refers to the passive movement of water molecule, this point is very important, passive movement of water molecules across semi-permeable membrane from an area of high water concentration, nothing but low solute concentration, to area of lower water concentration, that is higher solute concentration. So, now we will understand here with the pictorial representation. So, the movement of solvent, try to remember, not the movement of the solutes from the system, right, whereas the diffusion is nothing but movement of the solutes from the high concentration to low concentration, right, whereas osmosis is the movement of solvent or water molecules from the high water, or you can say low solute concentration to the high solute concentration. So, until to reach the equilibrium between the two sides of the semi-permeable membrane. Now, we will see this is the one system. Now, you can see the yellow color, right. So, which is you can see here which are the solutes. So, the number of solutes is very less and the high water concentration, right. So, here you have the high concentration. Now, these two things are there, here is the low solute concentration, high solute concentration, and in between we have a semi permeable membrane. So, that will help for the movement of the water molecules. Now, you can see another case to replace the or to maintain the equilibrium. So, your solvent will move from this place to this side through semi-permeable membrane to maintain the osmotic pressure. So, here the osmotic pressure is applied. So, that will help to resist the flow from the high solute to again into the low solute concentrations, right. So, now you can see when it is equilibrium maintained, then it stops the release of the drug or movement of the solute from one place to another pressure. So, this pressure principle is applied by taking up that osmotic agents into the components. So, that will help create the pressure, that pressure will release the drug from the devices. So, we will see one by one. Now, you can understand here, right. You can see this is a system of the osmotic drug delivery system. So, that outermost layer is semi-permeable membrane. We will see what are the components are the semi-permeable membranes, and also we will see the role, how it works for the treatment. So, this is the semi-permeable membrane, and you can see this is a drug reservoir which contains the drug as well as osmotic molecules, and here is the delivery orifice which will release the drug. So, this orifice or this hole can be made by the mechanical or by the some laser systems. So, after administration, now you can see the device is swallowed and reaches to the GI tract. Water diffuses into the core through the semi-permeable membrane. Now, you can see the water is entering from the GI membrane due to the osmotic gradient, because here we have high concentration, right. So, the water from the low concentration to it moving to high concentration, right. So, the water will move, right. So, then what happen internally the pressure will builds because of the osmotic molecules, right. So, the drug dissolves once the water is entered. So, drug dissolves and it forms a solution or suspension into that, then it will release or it will leach out or will leak out from this orifice, but that it will be controlled by using the osmotic pressure. So, the pressure pushes the drug solution out through the orifice at constant rate, right. So, this is a release mechanism of the osmotic drug delivery systems. Now, here you can see the structure of osmotic drug delivery systems. So, you can see these are the components and the role, right. So, core contains drug or osmotic agents. There are the cases we will see only single layer, there are the cases we use multi layers also, multi core systems also possible. And here is the semi-permeable membrane which help for the allows the water to enter, but not solute. Now, it will help for the entering of the water molecules, but it will not allow to go out because of the solutes. So, delivery orifice, now you can see here that performed or created by the laser, there are the cases we do mechanical also, that will allow the drug release. Now, here is the coating agent. So, that may be applied to control the permeability and the drug release of the system. So, here we will see the components which we will see in detail. So, here is the drug and these are the functions and these are the some examples. So, for your drug need to be the biological off life within the 1 to 6 hours, and if less than 1 and more than 12 are not feasible, more than 6 to 12 also not feasible, because to show the long term release or the prolonged therapy, your drug need to be have the biological half life within 1 to 6 hours, and your drug need to be minimum solubility, because otherwise if you have some water solubility or some solubility issues, such drugs cannot be used, because after diffusion of, after entering of the water through osmosis, that need to be solubilized with the water, right. So these are the various drugs can be used, and even the osmogen that will creates the osmotic pressure, it require high solubility and activity. So these are the osmotic agent, as I mentioned, inorganic, organic and polymers, sodium chloride, potassium chloride, magnesium sulfate, sorbitol, mannitol, and there are the polymer cells also can be used. Semi permeable membranes which will control the water entry, that must be water permeable, biocompatible, that should not release any drug molecule from the membrane. Example is cellulose acetate, polyester, polylactic acid can work as a semi permeable membrane in the osmotic drug delivery systems. So these are the few components. Again we can use hydrophilic polymers, hydrophobic polymers, these we use for the water soluble drugs and also which we can expect the control release, and hydrophobic polymers, those drugs which are highly water soluble, to control the release. So we can use hydrophobic polymer. These are the examples: hydroxypropyl methyl cellulose, hydroxyethyl cellulose, carboxymethyl cellulose, and ethyl cellulose, and the waxes works as a hydrophobic polymers. Weakening agents which will draw the water into the core, into the implantable devices or osmotic drug delivery system. So these are the weakening agents help for the water entry into the core, that will absorb the water into the system. Enhances the internal surface area. So these are the molecules like silicon dioxide, kaolin, sodium lauryl sulfate, polyvinyl pyrrolidine, titanium dioxide, bentonite can work as a weakening agent. Soluble agents are required, that will increase the drug solubility. If the drugs are some solubility issue, we can use various types of the polymers, and also surfactants can be helpful for the treatment of the water insoluble drugs. There are the other components like surfactants which will help in the improving the solubility as well as stabilizing the formulation. These are the various types of the agents. Coating agents we can use to dissolve the membrane forming polymers. When you want to prepare a semi permeable membranes, we need to disperse or dissolve in the various solvents. The coating or solubility solvents can be used. Plasticizers will help for the, will improve the flexibility and the permeability of the entire system. So these are the example: triethyl citrate, dialkyl phthalates, triacetyl phosphate can be used as a plasticizers. It will maintain the plasticity of the entire system. Flux regulators that will adjust the fluid permeability of the membrane. So these are the examples: PEG and PG can be used as a flux regulator. Pore forming agents are very important. So they internally they can create the membranes on the pore. This is also one of the types of osmotic drug delivery system. Those drugs are water insoluble, such cases pore forming agents are required, which will create the pores. We no need to use any orifices further for the during the preparation. So this will automatically create the pores and will release the drug. So with this we are going to stop today's lecture. So far we discussed on the what are the osmotic drug delivery systems, and also we have seen the what is the structure and components of osmotic drug delivery systems. So with this we are going to stop today's lecture. In our upcoming classes we are going to discuss on the what are the various types of osmotic drug delivery systems, and also we see the advantage, limitations, and we will see the what are the ideal characteristics of the osmotic drug delivery systems. Thank you so much.